Okay, so let me just bring up your file. Here we go. So you came to see my colleague around a year ago. Good, okay. So back again for the same reason, or? Okay. That's why you got referred to me. Okay. Okay. Let me just add that to your file, and then we can have a nice relaxing little chat. Okay. So, just create a new insert there. Okay. So, patient has described new symptoms, focusing mainly on acne and some associated redness. Some distress has been caused. Have you tried to self-medicate with this? You have? Okay. See, the trouble with following lots of online things is a lot of the time, the advice isn't really regulated by professionals, so it's best to just leave the skin and come to see someone like me. But don't worry, we're gonna sort you right out. So the patient has tried some spot treatments. Have you been doing things like masks? Yeah, okay. Is that for blackheads, or you're trying to do spot clearing masks? Right. Okay. So a mixture. Alright. And this has been causing you some stress and anxiety. That's completely understandable. Are you currently taking any medication? Okay, that's fine. Patient. Some medications can have effects on the skin, so it's always good to check. And typically, when did you notice the initial change in the skin? I see. Have you had any changes to your diet, exercise routine, any life changes, stresses? Okay. So you've been struggling to sleep a little bit, okay? Is that due to a change in work, college? Okay. Are you taking any medication for stress or to help you relax? You've recently discovered ASMR. Oh, good. And has that been helping? Wonderful. So, getting back into a more normal sleeping pattern, that will generally help with stress levels and can help with things like your skin if it's not hormonal. Okay then, so I made all my notes. So let's have a little observation. Okay. So I asked you to come here today with nothing on your skin. Thank you. Let's have a little look. Okay. So the skin to me doesn't actually look too bad. Everyone's skin is different and everyone's skin type is different. There's no one size fits all solution to skin. So it's my job really to find out what's going to work best for you and what's going to be the most manageable solution. So just by observing you, I can see that the zones that you have the spots in typically aren't zones that are related to hormones. Normally we see changes around the jawline and chin area. Yours are more on the forehead, which can relate to stress. Got some on the cheek areas, and you do have some pores blocked around the nose area. Okay, so what I'd like to do is I'm going to pop on some gloves and I'm just going to have a little feel and take a bit of a closer look. Is that okay? Lovely, I'll do that now then. Sometimes what can happen when we do try to deal with the skin ourselves is it can actually lead to the overproduction of the sebum, which is the oil. And by fiddling about, it can overactivate things. So let's just have a little feel. Okay. So what I'm feeling for is to see if there's any raised lumps under the skin that could indicate more cystic acne. To me, these are looking more like spots that can occur through poor diet and stress. So I think these are going to be, I don't like to give false hope, but I think these are going to be much easier to treat. Okay. Do you find that they clear at all? Okay, so when some cleared and new ones appear, do you tend to get them for a week or two and then they go? Okay, right. And how is your diet? Just give me a typical day. Okay. So that's quite high in processed foods and therefore oils. What I always like to recommend, you don't have to do any of this is just my advice. What I do like to recommend is just trying to eat clean And I know that's a bit of a trendy term, but all I mean by that is try to limit your amount of processed foods. So have your fresh fruit and vegetables, keep things varied. There's nothing wrong with having sugar and some sweets now and then, but what can happen is it can build up in your system, and combine that with not sleeping, feeling a bit stressed, can all build up. So there's nothing wrong with having lots of nice things, but for the sake of your skin, it's just good to keep an eye, try to limit coatings on things. If you do eat meat, try to eat nice lean meat. If you don't, then again, just lean forms of protein. Try to limit your spices, and sometimes activate spots. So everything in moderation, I think, is the best way to look at things. Okay, so what I'm observing is I think your skin is going to actually be very, very manageable. Okay, so that is very good news. I'm not seeing anything that's causing me great concern. I think that the type of skin you have is combination. You get a slightly oilier T-zone. You don't have too many spots around this area here, but you are getting a few, and they're varied in size, just around here. And then your pores are slightly blocked around the nose area. Okay, you've got a couple of spots on the cheek, and I do believe in Chinese face mapping, which delegates certain zones of the face relating to different things that are going on inside the body. So for me, I know that when I get spots on my cheek, that means that maybe I've got a bit of a cold, feeling a bit run down. It normally relates to something going on in the lung area. So for me personally at the moment, I have had a little bit of a cold and a germ, so I do have a little spot on my cheek. The most important thing is to not touch your skin when you have spots, because when you go to touch one and squeeze, you can risk it spreading the infection. So it's a good idea to just realistically think, why have I got these spots? I've got a couple on my forehead at the moment, and I have been a little bit more stressed. The important thing is to learn how to manage these things, because no one's skin is perfect. Okay, so what I'd like to do now is I'm going to cleanse this area with some special pre-soaked cleansing pads. Okay, and then I'm just going to do a little bit of blackhead removal. Okay, now normally what I would do if the blackheads I could sense were quite deep is I would steam the skin or apply a hot compress, and then I would do the extractions. Because yours aren't very deep and we've got a mixture of black and white heads, all I'm going to do is to cleanse the skin and then very, very gently do each extraction individually. Okay, so let me get the pads. So these are very special pads just made for our clinic, and they're nice and delicate on the skin, but they do contain a small amount of salicylic acid along with some other cleansing properties. So let's get out one of those now. Okay, lovely. So you're welcome to close your eyes during this, or you can keep your eyes open. Absolutely, that's fine. So let's just go over this again. So we're not going to go too high up. It's mainly just this zone here. Have you ever tried to do blackhead extractions before? Okay. So you do have to be careful because it can cause scarring if you do it incorrectly or press too hard. So it's really important just to be respectful of your skin. You know, our skin does heal, but once that tissue is damaged, it will take longer to try and heal a scar, and you do need to use healing oils or something on it, so just be mindful of that. Okay. Good. So now what we can do is we can get our tool, which of course has been sterilised. So this is the blackhead extraction tool, which I'm sure you are familiar with. Yeah. So there are so many videos of people using these online, and you can of course pick them up fairly inexpensively. What I would say again is it's really best to come to someone like me, just because we know how much pressure to apply, how deep the blackheads are, so it is worth just waiting it out. Okay, so what I'm going to do then is I'm just going to apply a bit of pressure with this hand, and then I'm just going to press down. So I'm going to do one, and then we will see how we go. Okay, I'm going to get another cleanser pad, and we'll use that to wipe the surface. How is that? Yeah? Okay, good. Some people don't have the best pain threshold. So a lot of these are, as I said, not too deep. So I'm going to use this flatter side here and just slide this gently over the skin. So let's do that now. So just and that's just picking up on some of the whiteheads as well. So do you use a moisturizer? Okay. Do you use quite a lot of products on your face? Okay. So we'll have a little talk in a moment about what we can do as a little bit of a treatment plan going forward, and typically that will involve reducing the amount of things that we use. Okay, good. So we just got one just here. Okay, just go a little bit more pressure. All done. There we go. Now I do need to do a little bit of a removal on the tip of the nose. It's an oddly uncomfortable place. You wouldn't really think it, but I'll be as quick as I can. Okay, so think of your favorite thing to do. Okay, and you're in that place right now, doing your favorite thing, and it's lovely. You're having such a lovely time. Okay, well done. Sorry, not the best. There we go. Alright, just come around this side just a little bit. Okay, so just there we go. And then just here. Some of them do require going in at a bit of an angle. Okay. So have a little more. Actually think quite happy with that. Okay, I think I'm just going to do a couple more. I don't like to overdo it in the first session because it can cause redness and irritation, and I like to see how a patient's skin reacts before, doing the whole face. So let's just do a couple more, and you will notice your nose looks a lot clearer because of this. And then we'll just do another one just here, just here. Perfect. Okay, let me just get a fresh cleansing cloth wipe. And okay. We'll just go over the skin. It's nice because it's a little bit cooling. Yeah. There we go. Lovely. How did you find that? Yeah, I know it can be a bit uncomfortable, but your nose looks nice and clean. Okay, good. Happy with that. So, let's talk about what to use on your skin. So you said that you do use a moisturizer. Okay. You mentioned you had a bit of itchiness. Yeah. Okay. Yeah, it's quite common, especially this time of year. Okay. As for the cleansing of your face, how do you do that? Okay. So we want to be using something that's quite gentle on the skin, and for me, what I like to do is I like to use a combination of removing my makeup with wipes. Now, a lot of people choose to use different types of cleansers and oils. For me and my skin type, sensitive wipes work best. And then I'll use a wash cleanser afterwards, and that's AM and PM. So the build-up that you have, I believe, can be helped with regular cleansing, because this area just here in particular can get quite clogged when it's not properly taken care of. So we can use something like this. This is just some personal recommendations, okay? So we can use this. I can actually take my gloves off for a moment. Okay, so we can use something like this, and this is just a mild facial wash. Now, we like to recommend products that are, of course, dermatologically tested, they're kind to the skin, nice and gentle. This one is fragrance free, which I personally think is the best way to go. And this is going to really help, especially with your oily T-zone. Okay, so this is definitely an option for you. If not, you could use some facial wipes. So these are really great to just wipe away the day. So you simply go over the skin, and I think the best thing to do is, if you have anything on your eyes, to remove that first, and you could do that with a liquid cleanser or a separate wipe. Then work your way around the face, and you may need to use 2 or 3. But what you don't want to be doing is wiping all of anything on your face into each other, if that makes sense. If you go too rough, you can cause skin tears, damage to the skin, wrinkles. That's not what we want. So nice and gentle over the skin. So literally just wiping over the skin. Don't forget to go down the neck. Now, during the winter periods, when you may be wearing more clothing and more layers, this can also cause more sweating, and sweat glands can become blocked. So it's really important to actually just take the wipe just a little bit down the chest area, just to finish off. And what that will do is it will really help to prevent any pores becoming blocked on the chest area. So don't just think that the wipe is limited to the face. It can go down the neck and onto the chest, but nice and gently, very, very gently. Okay, so that is all I want you to do for your whole cleansing routine. Yeah, nothing else. Okay, now for your slight itching, I have a couple of options. So option number 1 is very simple: some Vaseline. Now, Vaseline is fantastic stuff. You can use it around your nails in the winter months to keep them nice and moisturised, on dry skin, any place that needs a little bit of extra moisture. So can take some like this. Just going to take a very small amount. So dip your finger in, and then all I would recommend doing is just lightly rubbing that around your nose area. Now, if you are susceptible to colds, then your nose can get particularly dry. Use this right by your nose. That's really going to help. And with your skin being more moisturised, that's going to help to reduce that itchiness. Okay. The other option, now this option I would only really recommend to use at night time, purely because it's not very easy to cover up. So we can use pseudocreme. Now, pseudocreme is wonderful at soothing the skin. It can also actually be used to help with acne as well, but I would say to keep it to really soothing the skin. So again, apply this just as you would the Vaseline, and apply a small amount just around here, and that will really help to soothe any itching and redness, and that's a great little treatment to use overnight. So those are two, real household staples that you can use. So let's place that down. Then, if you wanted something that you can use not just on the face, but on the body as well, then I would recommend using the First Aid Beauty Ultra Repair Cream. So this I really love because it's perfect to just hydrate itchy, dry skin. And you can use this all over. And this is allergy tested and fragrance free, so it is safe for sensitive skin. And you can just apply this as needed, head to toe, throughout the day. So it's a really lightweight cream. You can see it's a bit like a souffle. It's really nice and light. And all I would do, again, small amount, and you can use this all over, hands, face, body, elbows, feet, wherever you like, and you can see how easily it just seeps in and it's nice and touch dry. So they are some options for you. Now, as for your little, just small acne scars, I would recommend using an oil to help with that. So, we all know of a very popular oil that you can use, but I would personally recommend this one because it is non-comedogenic, which basically means it doesn't clog your pores, and therefore it's not going to promote spots. So obviously test this out in a small area, massage in just a few drops just into where the scars have formed. You can use this on uneven skin tone and redness, age spots, anything like that. And all of the ingredients work really well to just gradually lighten the appearance of any pigmentation, but also help to reduce those scars. Now, if your acne scars do run quite deep, which yours don't, but if they did, you could have laser treatment on them, light therapy. So there are lots of different options, so never feel hopeless when it comes to skin. And this is really, really nice because you can use this to help with dryness as well, but it's just a nice oil to apply, and being able to apply an oil and know that it's not going to clog your pores is perfect for anyone suffering with any type of acne. So that's what we want. Now, once a week, and I do mean only once a week, I would recommend using a little exfoliating sponge. Now, if you don't have an exfoliating sponge, what you could use instead is a washcloth or flannel. You could use a little exfoliating mitt, or you could use an exfoliating scrub. But all you want to do is be extremely, and I can't stress this enough, but extremely gentle. The reason why though it's good to exfoliate is because you do get a build-up of dead skin. You know, it's just good to cleanse the surface, but it also does, you know, prevent the build-up underneath the skin. So this is a very gentle facial cloth, and you can just see that it's super gentle. You know, it's not scratching my hands. That's a really good test. You know, it's not hurting my hands. It's nice and gentle, and it's just going to give me that light exfoliation. So once a week I'd like you to do that. Then to treat your spots, because I believe that they are not particularly deep, I would recommend trying some tea tree oil. I would personally say to go for a blended one, just, you know, in case your skin reacts a bit too harshly to the pure oil, and just get a little cotton earbud and just dip it in the tea tree and then place it directly onto the spot. You could wear that under makeup if you wanted to, so do that a couple of times a day. If not, you can try anything that has tea tree, witch hazel, or a small amount of salicylic acid in. So your skin, I think, is going to benefit most from topical treatments, because I can see it reacted really well here just when I was doing the removal, so it shows me that it reacts to some type of treatment being done, even though that wasn't a topical treatment. But it shows me that it's workable. So what I would recommend is either something like this. So this is aptly named Spot Zapping Gel, and what this has in is tea tree and witch hazel with a little bit of that salicylic acid. So that is really the magic formula. And all this says is to cleanse your face and apply the gel directly onto the spots, morning and evening, or whenever needed. So this is a clear gel, and to all of my clients, you know, I say that, you know, there's no embarrassment of having any spot treatment on your face that you can see during the day, but if we can treat it invisibly, it gives you that little bit of extra confidence. So I do like to select products that I know you can't really see during the day. So this has a really easy applicator. It's just like this, and you just do apply it directly onto the spot. You do not want to apply this liberally over an area. Okay, it can cause excessive drying, so we don't want that. Another treatment we could use is acne-side, and I do talk about this a lot with my patients, but I just think it does do the job. It is a little bit stronger because this does contain benzoyl peroxide, but this is an effective way to treat your spots. So with this, again, do not apply this all over your face, or all over your chest or back, or wherever you have the acne. Apply this directly onto your spots. Okay, so again, use this morning, evening. You can easily apply this underneath makeup as well. It dries with a little bit of a white tinge to it, but if you put a bit of concealer on top, you wouldn't notice it. So that's a really good option for you, but do be careful because it can bleach clothing. Okay, so if you wear a black top or something to bed, or you're sleeping on a black pillowcase, just be aware that it could potentially stain. Now, if I did want to prescribe you something, I would prescribe you this, the Cintaclin 1% gel. So this is clindamycin phosphate, and for me, I prescribe this when I see my clients having acne that's quite widespread over their skin. So if it's in quite a cluster, and for example they couldn't just apply it directly to every spot, so I would prescribe this to put over the whole area. It acts a bit like a film, so you can use this a couple of times a day, but really I would say to use this at night. And again, use all of these after you've done your cleansing. Okay, so I'm not going to prescribe you this. What I am going to say is I will recommend those two products and the tea tree oil. Okay? Yeah? Fantastic. Let me type up your notes. Okay? So, we have done a blackhead extraction today. Good, and that was effective. We've talked through a treatment plan for the skin, and we have also discussed a potential change in diet, and hopefully with you sleeping better as well, you're going to notice a difference with these stress levels. Good. So are you happy to go and try those products that I have recommended? Yeah? What I would say is don't feel like you have to go out and buy all of them. Try one. Tea tree oil is quite inexpensive. You can get it in most places. You can get it in supermarkets. So try the tea tree. If you can't get blended, just use a very small amount and just again apply it directly. The good thing about the tea tree is you can apply it a few times in the day. Okay, so patient happy with recommendations. Do you have any questions based on what I've recommended today? It's really hard to try to give an estimate as to when skin will clear up. All I would say is, in your case, I feel like what's been happening is you haven't noticed that they've been going because you keep touching your skin, squeezing the spots, playing with the skin. So you're not really giving your skin a chance to recover. So with this plan, you're going to be letting your skin breathe. You're not going to be touching your skin, squeezing pimples, anything like that. And that's going to allow the tissue to repair, your skin to calm down, the inflammation to calm down. And I would honestly expect to start to see results within a couple of weeks. Realistically, I would like to see a change in the skin after a month. You know, with these things, you do have to stick at them, and you know, with the change in your diet, you may actually notice a slight increase to start with because your body's reacting, but that's natural. Stick with it, drink plenty of water. You know, it can be quite difficult, especially in the winter months, to drink a lot of water, but if you can, it's going to be better for your skin. So yeah, I would say it's looking really positive. I can't see any reason why you wouldn't start to see those results. I just think you've got into a bit of a bad pattern of behaviour, which is why you haven't seen a noticeable difference in a short amount of time. Yeah. Okay, so patient is happy with recommendations. The questions answered. So what I'd like to do is to book a follow-up appointment. Is that okay? You can do that outside at reception, but it's up to you. You can either book it in for a couple of weeks or you can book it in for a month's time, but within that period I would definitely like to see you again. Okay? So I think that is everything. Is there any other skin issue that you would like to discuss today, or you have any questions about? Yeah, if you have a tiny little spot there, again, you can just use the tea tree on that as well. Yeah? Wonderful. Okay, good. So I would also just say to be a little bit careful with scented body washes and things like that, and also what you use on your hair, because actually if you're using products on your hair like really strong shampoos and conditioners, if you think about it, it's all running down and it can run on your face. So just be aware of the products that you're using on the rest of your hair and body as well. Okay? I always think sensitive and fragrance free, if you can, is best. Okay? Well, it was so nice to meet you. I'm really, really glad that I've been able to help, because it's the worst thing when, you know, you don't feel your best because of your skin, and that was part of the reason why I got into this. So I'm glad I've been able to put your mind at ease. Okay? You're very welcome. So whenever you're ready, no rush, whenever you're ready, head out to reception, make that appointment for a time and date that suits you. Alright? And we'll catch up then, and hopefully we'll have noticed a good improvement, which I'm sure we will. Okay? No problem. Enjoy the rest of your day then. Okay. Bye-bye. Just look on the screen. They've got a similar issue actually. When are they coming in? A few minutes. Okay, that's fine. I think I'm just gonna go and get a glass of water. Where do I put my glass of water? I don't know. I think I should get a water cooler there. Okay, anyway, I'm gonna get a glass of water and prepare for next